discuss in detail about the stable or typical angina. What are the drugs we use in this particular stable or typical angina? So stable or typical angina, one important point what I have discussed is it is due to narrowing of the coronary arteries. Right, it is due to narrowing of the coronary arteries. Now, whenever there is narrowing of the coronary arteries, thereby what will happen? There will be decrease in the coronary blood flow. In this clinical scenario, whenever an individual has physical or emotional stress, right, whenever the individual has physical or emotional stress, what will happen is this physical or emotional stress will increase the heart rate of the individual, right, will not only increase the heart rate of the individual, will also increase the cardiac contraction, right, will also increase the cardiac contraction. Now both of these, whenever there is increase in the heart rate or whenever there is increase in the cardiac contraction, both of them will increase the myocardial oxygen demand. Right, both of them will increase the myocardial oxygen demand, and this will precipitate the angina. This will precipitate the angina. So this is the basic sequence of events what is happening in a patient with a stable or a typical angina. Now, what you want to do in these patients, the primary aim of the treatment is to reduce this acute attack. Right, the primary aim of your treatment is to reduce this particular acute attack. Not only to reduce this acute attack, the primary aim of your treatment should be to prevent further attack, and you should also be able to prevent the myocardial infarction, and thereby by reducing the acute attack, by decreasing or by preventing the further attack, by reducing or preventing the MI, what you will try to do, you will reduce the mortality of the individual. Right, you will reduce the mortality of the individual. So stable angina, what drugs have to be given now? Now for acute attack, the drug what we have to give is sublingual nitrates. Right, I have said you, when we are discussing the nitrates, I have discussed that depending upon the route of administration of these nitrates, the usage will be different. If you are using the sublingual route, it is useful for preventing the acute attack. But when you are using the same nitrates in the form of oral route or the transdermal route, you are using that nitrates for preventing the further attacks. That means you are using for prophylaxis. Alright, so to prevent the acute attack, what you have to use is you have to use the sublingual nitrates. Now, to prevent an acute attack in case of expected stress, now you are anticipating some stress in an individual, right? You are suspecting that there might be an occurrence of stress in an individual with stable angina. In such case, what you do is you give this particular sublingual nitrate 5 minutes before that, right? So if you are anticipating any stress, what you do, you give this particular sublingual nitrates 5 minutes before. So for reducing the acute attack or for preventing the acute attack, we are giving the sublingual nitrates. But for long-term prevention in stable angina, the drugs what we give is, for long-term prevention, we give beta blockers, we give calcium channel blockers for long-term prevention, We also give nitrates orally for long-term prevention. We also give ranolazine. We can also give ivabradine for long-term prevention. And not only that, along with these drugs, we can also give nicorandil for the long-term prevention, right? Now, so these are all your anti-anginal drugs for long-term prevention. But sublingual nitrate, it is for your acute attack. Remember, what is the basic pathogenesis in stable angina? The basic pathogenesis in stable angina is narrowing of the blood vessel wall. Now, how is this narrowing taking place? This narrowing is taking place by the slow and long-term accumulation of your platelets along with the fat. So, in order to prevent the long-term attack, not only giving the anti-anginal drugs, what you try to do is you prevent this particular narrowing by giving antiplatelet drugs, right? So, to prevent further narrowing of the coronary artery, what you can give is the antiplatelets. Now, what are those antiplatelets you can give is, these antiplatelets, they include number one, aspirin, right? And this particular aspirin we give in a dose of 81 to 325 milligrams. And if the individual is not tolerating this aspirin, because aspirin will cause a lot of gastritis or the aspirin will cause a lot of gastric irritation. So in those individuals who are intolerant to aspirin, you can also give another antiplatelet drug which is called clopidogrel, right? Which is called clopidogrel, right? So these are the antiplatelet drugs which you can give in stable or typical angina to prevent further narrowing. Now, if you take some of the drugs like vasodilators, what are these vasodilators? Vasodilators like nitroglycerin, calcium channel blockers, dipyridamole and papaverine, they are used for assessment of the coronary artery stenosis. And what exactly is your dipyridamole? Dipyridamole is an adenosine reuptake inhibitor that can cause the coronary steal phenomenon, right? Very important point regarding dipyridamole, what you should remember is it will cause the coronary steal phenomenon. But this is one of the drugs which can be used for assessment of coronary artery stenosis. And you take your papaverine. Papaverine is a short-acting vasodilator that acts by inhibiting this phosphodiesterase enzyme.